Welcome to Echoes of Healing Songs, a podcast exploring Indigenous and traditional knowledge systems that sustain communities across generations. This series was created as an invitation not to extract knowledge, but to listen differently in a time where global health and academic institutions are re-examining their foundations. We turn towards Indigenous wisdom to remind us that knowledge is relational, embodied, and inseparable from land, spirit, and community. I'm your host, Dr. Tharusha Naidu, and today our honored guest is Dr. Ntombizanele Menze. She is a qualified medical doctor and a certified traditional healer practicing in Port Elizabeth, South Africa. Her unique integrative approach supports healing by respecting both clinical science and cultural wisdom. With deep roots in modern medical training and traditional healing practices, Dr. Menze offers a rare combination of evidence-based medicine and ancestral wisdom. She believes that true healing addresses not just the physical body, but mind, spirit, and cultural identity of each patient. Dr. Menze, we are honored and excited to have you here with us today and looking forward to hearing your wisdom and your experiences. Please could you start by introducing yourself and telling us a little bit more about yourself from your perspective?
So I'll first say Thokozani Tamagwini Ndawo Weshewe. So what I've just done is a very grounded way of greeting that we use in the African spirituality, which actually means the divine in me sees and recognizes and embraces the divine in you and everybody that will be watching this podcast, because we believe that you don't only walk alone, but with soldiers from your lineage and your background. So that is Dr. Ntombizanele Menze. I am a GP, as you've said, that is practicing in Port Elizabeth. The name changed now to Gqebera. It's called Gqebera. There's a lot of clicks there. So I trained at Stellenbosch University, enjoyed my undergrad there, and then I went to do my internship in Pretoria, then conserve in Limpopo. So I've been all around the world and exposed to different cultures, and it's so interesting to see how we view our diseases across the different cultures, because in Limpopo, mental health sometimes is not seen as a Western phenomena, but it's seen as a disease in somebody's spirit, soul, sort of an imbalance, also a detachment from nature as well. So they articulate mental illness as there's something much more deeper in Limpopo, which was very interesting, quite culturally grounded, and I think that's why I enjoyed, and I actually yearned to go back to Limpopo because of the deep-rooted attachment to their roots and their cultures as well. So I started my REG program, but we're not going to go into detail about that in psychiatry, but I had always had this interest in blending the two worlds together and trying to understand the two worlds together. I think it all started when I was an undergrad. I think I did my elective program shadowing traditional healers at the time, and I was curious about, what their work is about, how they work. So I shadowed one of the healers, went around wherever they went and noted how they worked. I didn't know at the time that was probably a way of my ancestors trying to slowly introduce me to what I needed to do in the future. I always had this curiosity about the two worlds. Then I remember, I think it was around fourth year, where I met a client that had a very low CD4 count, and she said she went to a healer, and the healer told her that she's actually having a traditional healer calling. And I was concerned at the time, because now, yes, we're not saying that is not it's not possible, but remember, we are also a body that has organs, that has chemicals, etc. So I think there was a gap there in terms of psychoeducating all of us, including healers, about we're not only a spirit, but we're also body, we're biological as well, and we spiritual beings having a human experience, and we're not immune in not having illnesses of this realm. So I think that is where my interest started, not knowing that I'm slowly being introduced to who I'm meant to be in the future. Then as a registrar, I did a Mmed project as well that included healers. And the title was looking at the profiles of traditional healer and the healing practices. So I focused in the Western Cape part of the study. It was a two-arm study. My colleague Bertha did actually the Western Cape part of the study. It was the exact same study, but she did the Western Cape and I did the Eastern Cape. And the bigger picture was to compare the two provinces and see what came on. But the study was about looking at the profiles. Because if you want to start having a conversation about working together holistically in the system, then we need to understand each other and where we come from. So the study looked at who healers were, are they married, the demographics, are they Christians, and most importantly, the training journey, how it comes about and all of that, which was very, very interesting as well. I really enjoyed that. So that is where my passion comes around. And now what I usually do on a daily basis is blending the two worlds. So I'm here to destigmatize mental health, especially across my culture and my people and how we know things, and also with healers as well, destigmatizing mental health, that it's okay to have a mental illness, it's okay to have diabetes, it's okay to have, physical conditions, because we are having a human experience, we're having a physical body, as much as we understand that there's other causes that might be different to the Western explanation. There's other causes as well, which may be spiritual, whichever way that our clients want to articulate their dis-ease. We call it a dis-ease. We don't like to say diseases, but we call it a dis-ease. Yeah. So that is what I do on a daily basis. Yeah.
It's you've done such a lovely picture of showing how in your own life, your journey as a traditional healer and your journey as a medical doctor was intricately woven into each other. But you mentioned a few times how the ancestors gave you space to learn what your journey was going to be by guiding you towards the kind of research that you're doing, the kind of spaces that you went on, your experiences. But can you tell us a little bit more about the relationship between ancestral calling you mentioned, and even tell us the name in isiXhosa, what that relationship is? How do you come to be called, and the relationship between the ancestors? It's more than a vocational calling, it's something deeper. Can you tell us about that?
Absolutely. Thank you for that question, because everybody wants to understand what is this calling about. So when I start explaining, is everybody has some form of a calling or some form of a purpose. So it's different for different people. So we call it ukutwasa in the African language. So it means that there's a child in this family that has a spiritual gift, right? That is passed on initially from God. So God is the ultimate that has given you this gift. That is how I explain to my mentees as well. So how I explain to them, so there's a God. The God has given you this beautiful gift, whether to be a doctor and excel in your medicine, whether to be a nurse and be an exceptional nurse, whether you are going to be a person that heals spiritually, depending on the type of gift you are given to your family. But it's all to do with aligning others with their divine purpose. So how I usually explain, to make it very, very simple, because people are like, is it from God? Is it from the ancestors? What's happening? But ancestors lived here. How can they give me a gift? It doesn't make sense. So how I explain it, picture this. You are going to become a doctor. So already God has given you, I'm just making it, given you the gift of becoming a doctor, right?
Yes.
In your lineage, there's already people in your lineage that had a similar gift of being a doctor. Right? So what happened? So these people now, we're referring to them as the ancestors. They had a similar gift that is given by God of becoming a medical doctor. So what happens? Where does the ancestors now come in all of this? So usually I would tell them, let's say there was an ancestor, there was a ENT specialist. There's another one that was a pediatrician. There was another one that was a gynecologist, and so forth and so on. The one that was an ENT has a special ENT set, for instance, and they will say, with this ENT set, I was excelling in making beautiful diagnosis, and they will decide like to give it to this lady or to this little child that is also gifted or has something similar to what the rest of the family has, right? And then another one will come, they will say, I was a gynecologist, this is my instrument that I use, and I excelled in the instrument that I use to make a proper diagnosis. Cardiologists would come through and say, I was a cardiologist, for instance, and I, with this stethoscope, I listened to the faintest of hearts, I made the best the diagnosis with this particular stethoscope. It doesn't make sense for these gifts to be bestowed upon somebody who's not gifted similarly to their ancestors, because their body makeup, their temperament, and their personality is not going to withstand the challenges that come with the gift along the way.
So God or a higher spirit gives the gift, but the ancestors over generations inspire and pass the confidence maybe and the skills. So it's an intergenerational knowledge that is passed down once the gift has been given. It's very interesting you say that, because as you might know, we're interviewing other traditional and indigenous healers from on this project, or healers or medicine people or whatever we call them, because today we call them physicians, doctors, cardiologists, but they've always been there. We call them healers, we call them sangoma, whatever the name's going to be, but everybody has that tradition. What was interesting is that almost every person that we've interviewed have had family members, and it seems to run through families. Is it necessary that it runs through families, or what? How does that part work?
So it's definitely necessary, because there's not all families will have a spiritual gift, right? There's selected few that must. Yes, you're a doctor, but you'll see a doctor that is spiritually gifted. They go beyond the scope of practice. You'll sit here and you'll pick up other things. Your aura, your energy, everything about you is healing. It's I don't know how to describe it. When somebody has a calling to become something, it's much more deeper. You will see this person is not just a doctor, but she's living this thing. So it is passed from family to family. And what I often see is that I get a client, maybe a child, let's say 14 years old, and I pick up this child. Is actually the symptoms are spiritually gifted, and the family will be no ways, because nobody in the family is actually spiritually gifted. We don't know of anyone that was gifted. All to find that there was a change and a shift during the colonial system, or during that time, where people detach from who they meant to be. They detach from their culture, their roots, the rituals and the customs. So then they converted to become Christians, for a longest of time. So you'll notice there's a generation that actually had omitted doing cultural practices. It doesn't mean the ones before them were never gifted. And now the issue is, these generation have now passed. Nobody has taken up the calling. The load of healing in this particular family has now increased, and unfortunately the youngest generation unfortunately has to now bear the weight of the rest of the lineage, which is actually quite sad. And these families will tell you, no matter how we pray and apologize, the symptoms are just continuing. Our child is dreaming about ceremonies. We don't know what to do anymore. She doesn't want to go to school. She faints at school. And that is beyond now apologies, because remember, there's now a backlog of family members that didn't take up on the gift and the calling. But usually, just to answer your question shortly, it does come from a lineage. That's why I made an example of this, the creator, whichever way you want to articulate and describe your creator that has given this gift, and this gift will be yours. And then in the family, there's also ancestors and people in the lineage that had a similar gift, but because they couldn't continue, they passed on, but they wanted to still continue with their work. They're going to pass it on, some of their gifts, to Zanele. Take the stethoscope and continue, or take this part of my gift and continue, etc. So it is familial as well. Yeah.
So a couple of things that you've said there. One, that the colonial invasion detached people from their ancestral lineage. So they had to detach themselves to survive in this colonial world that we both know. Or they were pulled away from it, and derogatory names were given to their healing practices and their spiritual practices, and they were made to seem dangerous and evil and wrong by outsiders. So they had to detach from it. They were persecuted. But this strength of healing practice and healing knowledge doesn't go away. It passes down to generations and gets held in bodies and spirits. So there's such an intricate weaving of greater spirit, knowledge, skill, intergenerational knowledge that's passed through, even not consciously, but through people's energy from their ancestors. And so this colonial slash really cut it down, but it's re-emerging. And then people like you are nurturing it, hopefully, are nurturing it. I think it sounds like you are. So community plays a big role in this. And you mentioned that you just told the stories of how you as a healer, the family, the ancestors share the responsibility of nurturing healers and healing practices. How is this knowledge transmitted? Is it consciously, or how do you transmit this knowledge? What's the training like? And also, before you answer the question, I want to just acknowledge and respect that some knowledge and some ways of doing and talking in traditional and indigenous practices are not spoken about because they're not supposed to be articulated consciously because it's not the space that it should be spoken about in. This is across all traditions. So keeping that in mind, tell us how the knowledge is shared, both in the community and through new healers. How are people taught?
Yeah, so people are taught through their dreams a lot. So we get a lot of information from our ancestors through dreams. We get to see certain ceremonies, how they were done, why they were done. Because remember now, because of the colonial system of the past, people know vaguely about certain ceremonies, but they don't really understand what the essence and the meaning behind each ceremonies. There's terms used as paying for damages, for instance, which is not a term that we use. I'm sure maybe I must ask you what the term of paying for damages mean to you. Have you heard of that term?
So I've worked in, this is a good question, and it's good for you to ask me. So I have worked, in mental health in South Africa as well. And so I know that the term paying for damages is used differently, but the way I understand it is that when a person is born out of their family line for whatever reason, the family of the father needs to pay the mother's family, give a gift of offering, not to pay for damaging the woman's body, but to pay to draw the soul of the child into their family lineage so that their ancestors can see and recognize them. Because if they don't do that, then that child's spirit is lost to the family and the child is lost. And this is not a good thing for the family. You can tell me.
I love that experience. That was excellent. That is exactly that. So it comes important when I marry, and I've got a daughter, and me and the dad were never married, and there were no we call it intaulo in our language, paying for damages. But the meaning is exactly what you are saying. It becomes a problem if my child has now ailments or diseases that warrants her to connect with the paternal side of the family. So if that ceremony, if that procedure was not done, the child grows up, things might open and close, get to school, okay, and then somewhere there's a blockage and people don't understand where the blockage is coming from, or to find that the roots of this child is not really steady. And we pay so much attention to root-related spiritual errors as healers. When we see clients, it's not all about the herbs and, making the diagnosis, but most of the time what I pick up, and I think what my duty is as part of restoring the dignity, is connecting people with their ancestors. Where does it start? It starts with our roots. So when my daughter goes and prays and says, I'm calling my ancestors of light from my dad's side of the family, they're not going to be like, whoa, we don't know who the hell is this now? Who's this person now? She was never even introduced to us. Or let's say I marry and this child, that first procedure was never done. it means that this child is still going to have issues and problems. So the root in our culture is so crucial. And in Western terms, we'll talk about the base chakra. But for us in the African spirituality, when we look at the base chakra, we're actually looking at the root related spiritual areas. There's certain ceremonies that are also done to introduce formally a child after birth. In those days, before colonialism, it was done as the child comes through from the hospital or being delivered. Already the family is preparing for that particular ceremony. But because of the colonial system, people have detached. Mine was done when I was an intern, to be honest with you. That is now way long, and that was because my daddy knew that I've got a spiritual gift and I need to be up to date with all my spiritual related ceremonies and things. It was done, but technically it was supposed to be done when I was still a baby, right? The formal introduction. So we look at that quite a bit. So when a healer comes and sees and have a dream, they don't only dream about that is the diagnosis, that is the problem. We also look at we also get messages about our rituals, about our customs, about how we the way of life, how we used to live, how does a black person carry themselves, etc. But most of the messages is from the dreams that we get. But we also have mentors within our societies as well. Yeah.
What you are highlighting is so important. Is that, I mean, and as you know, the base chakra is not from Western, it's from Asian. It's the sacral chakra is from Asian, but it, a lot of times culture is appropriated. So when we talk about base chakra, we're talking about rooting also, but it's from Asian culture. So what's interesting is the two ways of communicating that you mentioned, which are so powerful in African traditional healing, is one, the dreams. I mean, imagine if you went to a Western doctor and they came to you and they said, I dreamt. Most people would walk out the door. But this is a crucial part of communication. It's taken not just for granted, it's accepted and it's powerful. So that knowledge, the way you say it, doesn't just pass through dreams, but the whole, it's not just vague dreaming, it's clear dreaming. It's clear.
Absolutely.
You said it's clear enough that a whole ritual can be taught to you and revealed to you in a dream. And as an African person and a healer, you don't question the vehicle of the knowledge. You don't question that dreams, which we all have as human beings, that's not a valid knowledge system. All of us have it. And so that is obviously a valid system. And it's a system that you're communicating with your ancestors. Do you find that as you respect and use that system, it becomes easier to use and stronger? Do you find that neglected ways of doing things become easier and stronger the more that you do it?
Absolutely. So I'm going to go to the past. So
Yes.
during those eras of our ancestors, remember, even the community used to have a very similar content in terms of dreams. They used to sit around the fire, right? And share their dream, what they dreamed. You'll notice the whole community's content, this dream is actually very, very similar. There's a particular message for that particular community, which is what it was absolutely powerful. So if there's threat coming through to this particular community, they will dream about it, and it will be a consistent theme without anyone actually knowing what's going to happen, which is very interesting. Even same with families. I worry when there's a family that comes to see me and they couldn't pick up things that are about to happen in the family. There's supposed to be a dreamer in our families, even if they're not gifted to go and become a traditional healer, but the dreamer that is there to bring messages across the family, That
is so powerful and so exciting, and also so soothing and healing in a way, because I'm thinking of two other examples that I know, and I hope I'm not messing them up, but you can share, is the example of in indigenous North American culture, where they have literally a thing called dream catchers, and the respect for dreaming, as far as I know, is very strong, the respect for dreaming. But then I'm also thinking of the biblical story of Joseph, and people seem to just I don't know, it's not emphasized as much, that the whole story
Mm,
of Joseph was initiated by a series of dreams, a
mm,
very long series of very clear and powerful dreams. And so,
mm,
that makes me think that dreaming is really such a natural way of us interacting as
mm.
human beings. And this collective dreaming is such a fascinating phenomenon. Do you perhaps have any example from what you know? Because I'm thinking about what would have happened in South Africa just
Mm,
before apartheid ended. I wonder what the kinds of
mm,
dreams would have happened
would have
with
yeah
people.
come up from
We don't
there.
know. Yeah, we don't know.
So it's absolutely beautiful. So I don't know if you heard of there's Sanusi called a Credo Mutua.
Yes,
Have you
of
heard about
course.
Credo
Of
Mutua?
course. Yes.
Yeah.
Of course, of
So
course.
he had dreams and
But wait a
visions.
minute. Just for the rest of our audience, will you explain who Credo Mutua is?
Mm. So I'm going to use the term Isanusi. So this is somebody that was highly gifted, who was a prophet, but sort of a highly, I would say, a professor, just to put it in lame terms, a professor of
Yeah.
prophets. So he
A
predicted a
philosopher, even.
lot of things, that a series of things, some of the things are actually happening now already. I think he
Mm-hmm,
already
mm-hmm,
predicted this current war that we're actually in.
mm-hmm, mm-hmm,
So he got messages via visions and
mm-hmm,
prophetic dreams as well. But most of all of his prediction actually came through. So there was a series of dreams, a series of visions that he actually had. He was one of the very most powerful
yeah,
prophets that we actually could have had.
in
Yeah,
South Africa. Yeah,
so
yeah.
meaning that part of the dream in African culture and African spiritual is very, very important. So sometimes
Mm-hmm,
I get patients that they say they're gifted, and then you need to dive deeper in terms of, what the content of the dream is. Remember, dreams are
mm-hmm,
there not only because we are gifted, but also the messages that come across is that I'm a bit stressed right now. I'm a bit anxious right now. I've got
mm-hmm,
anger issues right now. It can tell you about your
mm-hmm,
current situation, but for those who are spiritually gifted, the dreams are vivid and it can pass on
mm-hmm,
very important messages. But the
mm-hmm,
content of the dream is very, very important. What is there in
mm-hmm,
the dream? How did you feel? What were you dressed like? Who
mm-hmm,
were you with?
mm-hmm,
Um, for those that dream, the content is about being a traditional healer. What beads were you wearing? What kind of beads? Who was giving you the beads? How were they dancing? Where were they dancing? All of those things are very,
mm-hmm.
very important in a dream. That information is so, so valuable for a healer. Somebody sent me a dream just before I came this morning. It's quite symbolic. It's actually the son. I think he's about 7 or 6. It's highly symbolic dream that this child had about the mom who's supposed to start the journey. Mom is quite distracted at the moment. There's a lot happening. So she can't get the proper messages at the moment. So we need to sort her mental health first. And then she can actually start with the journey. But now, guess what? The little boy is the one who's dreaming on the behalf of the mom at the moment. And it's
Oh,
quite symbolic dreams that we are having at the moment. Yeah. And also the research I've done that involved healers. Majority of my healers actually receive their calling through dreams and revelations. About maybe 99% of them. There was maybe one person that had a psychotic outburst during the
mm-hmm,
interview, and this person actually ended up being treated by her dad. The dad became a trainer. She was an engineer, and then after
mm-hmm,
she started the training, miraculously the symptoms disappeared. So majority of the messages we get is through dreams. I dreamed of when I was at the initiation school. Some of the messages and the surnames that came up there is some surnames that I don't know about now. But when I
mm-hmm.
researched my family, they said, yes, 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 your grandpa actually used a foster surname. He was about to change to the real surname. This is the surname that your
Wow.
grandfather was about to. And then apparently I also went into a trance as well. And then this old grandfather mentioned this name and this surname, which actually made a lot of sense in terms of, because I already dreamed about that as well. So the dream part is so crucial within our society, within African spirituality. There should be a dreamer in each family, somebody that knows. Grandfather came through, he wants a particular ceremony. And then there was, oh my word, we know about it, we've been trying to gather money for it, it will be a young child dreaming about this. It will be actually shocking. Or they dream and say, this is how this ceremony needs to be done. It's absolutely beautiful. The messages is through dreams, and it's so crucial and so important as well.
You are saying such important and powerful things. I want to just see if I understand you correctly and I understand the story of what you're saying. You're saying that all of this starts with a higher power or spirit that gives, that almost gifts the community and some individuals with this power to communicate outside of the realms that Western people and Western knowledge systems accept. And that is given. And it needs to be accepted and nurtured and carried down through families, and the community needs to nurture it and use it as well. The ways in which it's communicated most predominantly is through dreams. And so much so, it's so important, you're saying, this method of communication that the spirit communicates with communities and families is so important that there needs to be a dreamer in every family to interpret and to receive the knowledge for families. So the means of communication, of transitioning this knowledge and this way of doing from one generation to another is dreams. But you as a medical doctor now, you haven't left that behind. You're reminding people that there's also a body in the system, and that we communicate, people are communicated to through their bodies. Do you work, what does the traditional systems, what are the means of healing the body in the traditional systems?
Okay, so different. It also goes back to, it's not one size fits all, number one. So it's different for different diseases of a client. So we use the 4 element. When we look at each and every client, we use the 4 elements. We look at the water element, we look at I'm going to explain just now what I mean by that. The water element, the fire element. I've got a candle on here. This is the fire. We can use it as a fire element. Then there is the earth element, and there is the fire, the air element. So I'm using an incense just for your viewers. There's an incense. I use it as an air element, but you can replace it with maybe impepo or sage as well as an air element. So when we look at the client, one of those avenues or one of those, what can I call it? One of those aspects is much more in dis-ease or in disconnect or in misalignment, to say. When you look, I'm just going to give a very brief example. Let's look at the earth element. When I look at the person and I pick up, oh my goodness, the earth element is a bit dysfunctional here. What does that mean? It means I need to look at this person's grounding, right? Then we go back to the root related issue and I pick up, oh my goodness, this is a problem. There's a ceremony. Yes, it was done, but it was done in a wrong way. So a lot of the time with the earth element, I pick up a lot of root related issues, but then I also that manifests in somebody that feels like they're not grounded, they feel lost, they directionless, they start the project, they don't complete the project, what is going on, I'm just not at ease, I'm just restless. Something is making me unrestless. We look at the grounding elements there and look at it, what could be the issue is here. And we treat it according to, it's just one example, but there's a lot of other examples when you look at the grounding element. So in that instance, yes, the ceremony is needed, but what do we do with the grounding, the physical manifestation of the grounding issues that we are picking up? So some healers, nature will be something very good for this particular patient. Lots of work in nature. There might be a call for them to go to a forest, and there's certain rituals that needs to be done in the forest as part of the grounding process to reconnect with that root that is not. Remember, there's also ancestors or spirits that we connect with in the forest, in the waters, etc. So part of that particular person, it will be, you will notice you need to bring so and so. I can't now disclose what we need to bring, and then you need to visit. It can be the forest, it can be the cave, it can be the mountain, depending on this particular person and their particular issue and the spirits or the ancestors that had come across around that time. While I'm navigating around, what can we do now? She also needs medication that I'm in a a beautiful spot where I can actually spot that maybe she might benefit from an anti-anxiety medication while we're navigating all of this beautifully together, which is absolutely beautiful. Then
Yeah.
somebody that's struggling with a lot of fire element issues as well. How would they present in terms of fire issue? You'll hear they're very disruptive at home, they've got anger issues, and then you look at back, what's happening? Where does it come from? Let's go back, where does this anger, where did it start? Then you pick up, oh my goodness, this particular patient did not grow up with a father, right? And there's a long need for that connection with there's stuff outstanding there between spiritually, between this patient and the paternal side of the family, and that is where everything is coming from. The rage, the anger, the dominance, and all of those things. It's just one of many examples. I'm just giving very brief examples.
No, I love the examples, because beyond what you're saying, I'm hearing that I like what you said about not one size fits all, that you have to really engage with the person diagnostically, for want of a better term, to understand where the problem arises, where it's in those elements. And then you have to decide what the particular treatment is. But what's occurring to me and how you're describing it is how you can't do this if you're not patient-centered. So the Western system is so categorical and horizontal and vertical that you don't have to be patient-centered, but you can hone in on a diagnosis for one size fits all. But the way this traditional system is very wisely set up, or wisely, how it wisely emerged, was it compels you to be patient-centered. Otherwise, you can't do the work. You can't do it.
Not even patient-centered. It's go deeper than that. Lineal-centered. So when I heal a patient, I manage a patient spiritually. I'm not only healing him here, I'm healing him and the ancestors he's walking with, meaning the lineage, those on the other side. I'm also healing the lineage here as well. So we don't do anything in isolation in African spiritual, which is a bit different to the Western ways of doing things. We don't do things in isolation. It's very important that family is all speaking the same language when it comes to healing a client. It is only going to affect the whole family. So whatever you do, because remember, it's got to do with rituals and customs and fixing those, which somebody cannot do in isolation. And some of the rituals might even affect the community and the society as well, right? So it goes deeper than that. So when I see a client, I'm very strict with young patients that want to come and see me on their own. 18s, the 22s, I want to see them with which is different to the Western trend, because patient autonomy and all of that. But when it comes to spirituality, patient autonomy is important, but also lineal autonomy is important, because whatever I'm going to be doing, the whole family might be affected by it. There's a guy who said there's trauma in the family, a lot of deaths that happen within the family, accidents after accidents, and he went secretly to go and cleanse himself. So we know in the African spirituality that is not a good thing, because remember that those accidents has now brought some form of a dark energy within that whole lineage. Not only the people here in the physical realm, but also the people in the spiritual realm. It doesn't make sense now why Dr. Menze is going to secretly go and cleanse herself only, while the whole lineage is affected by that. So the whole lineage has to be managed. But my duty will be to look at why is this family struggling with accidents, constant accidents, car accidents, somebody burned and somebody was stabbed, what happened? All to find that sometimes there's a grandfather that died from an accident long ago, right? And his spirit is not at peace, and what the grandfather, his spirit is not happy. He's now taking on some of the family members because they did not acknowledge and assist him to transcend beautifully to the other side. So he's almost like a wandering, very angry spirit. In order to catch attention, he will actually cause a lot of accidents within the family as well. So it's very important in our families, when there's an accident, it needs to be cleansed, we need to almost mourn, but and also include the cleansing process to cleanse the whole family. So whatever
So it's
I
in a
do,
way
hmm,
similar to
yeah,
the basic concept of damages. So the whole of African traditional healing is always about bringing all the spirits of a family and a lineage together and aligned
absolutely,
and healed. So
absolutely,
this example that you gave also is about including this lost spirit back into the lineage. So
absolutely.
this new thing that we talk about now of intergenerational trauma is really
Mm,
what the whole of the African traditional healing system is based on. It's about
mm,
keeping the generational lines
mm,
aligned, flowing with their
absolutely.
purpose. And the way you're doing that is to listen through dreams, to connect very powerfully with nature, to
Mm,
respect community, to listen to spirit, and to really
mm,
connect around these things and not disrespect any ways of communicating. And to
mm,
be, words that we use loosely today, like inclusive, the way you
mm,
talking about it is a whole different way. It's like 360 inclusive, where you include
mm,
the past and the future. You include
absolutely.
the spirit and the land and nature. It's,
Mm,
the way you explain it is so powerful and
mm,
so I have to say it's like it just soothes the spirit
mm.
to hear the way you
Absolutely beautiful.
explain it.
So sometimes I get a female. So now we were talking about gynecological issues. There's a lot happening there at the moment in the African
Mhm.
spirituality. So me and my friend of mine is also beautiful psychologist, who's a healer. We were talking about, fibroids and what's happening, with the fibroid outbreak and
Mhm.
all of that. I know
Mhm.
there's Western explanations, but what we've
Mhm.
seen, remember in the lifespan of a black female, of an African female, there's certain ceremonies that are done when you reach a particular milestone in your life. But because we were
Mhm.
detached from what we meant to be doing in terms of customs and rituals, most of
Mhm.
us never did all of those ceremonies, when we reach a particular milestone. When a child starts a
Mhm.
period, it's
Mhm.
celebrated, it's beautiful, everybody's
Mhm.
celebrating. Oh my word, she's
Mhm.
becoming a woman, and there's a
Mhm.
ceremony done, etc. Up until when
Mhm.
you reach a point where you need now to go and get married, there's a send off ceremony that is done,
Mhm.
which is beautiful. And a lot of times I pick up, oh my goodness, yes, there is in Western, because now it has manifested within the body. And I know there is scientific explanations of it, but
Mhm.
also there's a misalignment with the female lineal spiritual ceremonies that were needed to be done. There were some errors and deaths within that family. And then we need to
Mhm.
acknowledge that as well. Or family that, just the women in this family are having miscarriages. What's happening here?
Mhm.
None of the women
Mhm.
are actually having children. We
Mhm.
respect and we embrace Western explanations, but we also know that there's other African explanations as well about why a particular
Mhm.
family or lineage, there's struggle, and then sometimes we need to
Mhm.
go back in history, and sometimes we need to heal that first grandmother that had issues with pregnancy, and then heal her. Once she's healed, you'll notice that the whole family or the future generation is actually also healed as well. So that is how deep we work. We don't only look at the person here, but we take into cognizance where does the root of this issue come from, and then we take it from there, which is absolutely beautiful. Yeah.
It is. It is. It's really powerful. Um, and it's wonderful that you're able to talk about this and bring it out after everything that's happened in our country and how different ways of knowledge have been suppressed. We've been, I
Mm,
don't know if you would agree, but I think we've been deprived as human beings of
mm,
this powerful knowledge,
mm,
that there's so many different ways of healing, that our healing in our
absolutely.
bodies are not just on our shoulders, that ancestors
Absolutely.
before us carry the knowledge. They have
Mm,
the secrets that we
mm,
think are secrets. They have the knowledge, and
absolutely.
they give people like you the
Mm,
messages that you are able to carry forward. Dr. Menze,
absolutely.
you have been a sage, a healer, a teacher to us today, and to say it's an honor just is not enough. You've
Mm,
opened. I'm hoping that your voice will be carried to many places through this, and that you will open the minds, and your voice will be heard, will allow people to hear things differently. So just to close, is there some message that you'd like to give, or anything you'd like to say? Take your time to feel into it if you need to, but just some wisdom or some humanity from your space that you can share with us.
So I want to just embrace the fact that we live in a beautiful era where I think it's a global awakening that is currently happening at the moment. Everybody is now opening their eyes to say we are not only the body, but there's something much more bigger. We're such complex beings, navigating this earth at the moment. And what I, as a clinician, usually, hold on to is the fact that respecting the way that our clients are articulating their diseases and walking the journey with them, right? We do know that there are biological causes, psychological causes, social causes, and it's important for us to embrace that side as well. But we know there is also spiritual and cultural causes that we have to respect as well when it comes to dealing with each and every, or managing each and every of our patients. Just a little bit, maybe, because I don't know, Spirit wants me to explain again about, the African spirituality. There's a gift, there's a lineage that has a gift. The gift is different from different people. It cannot put in one box. We cannot say which step you start with. It's different because it's led by your ancestors, how you need to navigate. Some of those that are gifted don't even need to become traditional healers. They are just healers in their own space, in their own way, wherever that they are, being a teacher, a doctor, etc. But some of us are called to do something much more bigger than just being a doctor, in terms of healing the spirit as well, and healing the soul as well, which is going to be something much more deeper than my medical training has warranted. It's different for different people. So how we also receive the signs and symptoms, because people like to talk about signs and symptoms of somebody who is recording, is absolutely different as well. It's not going to be the same. It's not copy, one size fits all. It's never the same, because it's led by different ancestors from different lineages. That goes back to also the purposes of the gift is also different as well, because it's different from different lineages as well. But I want to emphasize is that the purpose is about alignment, healing, empowering others with who they're meant to be while navigating on this earth as well. So that is what it is about. So if you look at how Gogo Menze works, or Gogo Zara works, it's going to be completely different to how Gogo Tembi work, or Gogo Mafelimpini works. It's completely different. When you enter my space, it might look a little bit different, and how I diagnose might be a little bit different, and the gifts I work with might be a little bit different. But we as healers are now in a stage of acknowledging that not all clients that are coming through maybe have the issues that I am in line with in terms of the gifts that I work with, right? I don't know if you understand that part. It means
I do.
Not every client that walks in is coming with issues that is in alignment with the gifts that I have. I, as a healer, need to understand what the gift is, who gave me the gift, and how the gift needs to be navigated, and what my speciality is within the gift. Because now if I don't do that, I become greedy and I want to treat everybody, and I cause a mess and even more turmoil in a patient's life. So it's very important as a duty of a healer to understand, and we are actually moving in that direction where we understand not every client I need to treat, because I might not have all the gifts to heal that particular patient, so it's very important to acknowledge that as well. So healers specialize in different things. I think I wanted to also mention that there's ones that are specializing in children. There's a beautiful healer called the traditional pediatrician, and she's doing an excellent job with children, with babies and pregnant ladies. There's healers who specializes in doing readings. When I look at you, I can scan you and I know exactly what your weaknesses, what your strengths are, and where the issues are, whether it's biological, psychological, social, or even spiritual, I will know exactly how that is as well. So it's very, very important for us to understand that it's a broad spectrum of a field. Healers are broadly gifted, absolutely beautifully so. There's a healer that actually was part of a hospital's obstetric ward. When there's complications, difficult cases, they actually call her to come in. She's a spiritual midwife or traditional midwife that specializes. And remember, those days we didn't go to hospitals because there were no hospitals in the era of our ancestors, and they used to do all of these things, and they know the herbs and what to use when and why when they deliver a baby, etc. So it's quite differently gifted, and the way we receive the calling and how we navigate around it is different because we led by different ancestors. So it's not going to be like Western, you do first year, second year, third year, fourth year, It's absolutely different because we're working with absolutely different ancestors from different lineages with different purposes as well. But the healing is there to heal and align others with their divine purposes. What you search on the internet might be something that is completely not what healers do. Things like finding lost lovers comes up when you search on the internet. Things like love potions come up when you search on the internet what traditional healer is. If I could make a love potion, maybe I would have 10 boyfriends by now. I don't have a boyfriend because I don't know how to make a love potion. If I could find lost lovers, maybe I could find my exes. I don't have that ability. If I had a magic wand to make people rich, I would be rich by now. So it's much more deeper than that. It's not something that happens overnight. Spiritual work is something that is so beautiful and graceful, and it warrants a lot of work because you're not only dealing with the person in front of you, but you're also dealing with lineal stuff as well that comes with the person that is causing a little bit of a dis-ease or a dysfunction or a misalignment within their soul and spirit as well. So that is what we all about, and it's a beautiful era where we are embracing and actually so passionate and excited about restoring the dignity of African spirituality. And while I'm navigating my Western passion, which is mental health as well at the same time. Yeah, but we are going back now, and more clients are now open. I've got a beautiful client going back to basics, aligning with his lineal customs, and because he's now around the age where our fathers used to now be the ones that are involved with ceremonies and rituals. So they are now coming through, 40-year-olds, 39-year-olds, 35-year-olds are coming through, and they say, I want to learn a lot about where we come from, how we used to do things, because I feel there's definitely a mismatch in terms of, alignment with our roots and our values. There was something powerful in terms of our roots and our values and our culture. Our morals,
finding their way back.
People are absolutely, and there's now this moral decay that is happening around, and we're wondering, is it about that we detach so much further from who we meant to be, because our cultures are so beautiful. There's a lot of Ubuntu, which is I am because we are, humanity that is instilled within our cultures, which we have detached a little bit, and people want to go back there because everything we do in African spirituality is all about respect. And respecting the people around us, respecting yourself first, and respecting the people around us, instilling good morals and values. But we have now detached from all of those things, and now there's a call for a global awakening to go back to basics now. I see people moving back to the rural areas. They are starting to plant. They are starting to find themselves. They're researching how did this particular lineage used to do things. Remember, in the African spirituality, we have clan names as well, and different clan names do things differently as well. And people have detached from how did I'm going to make an example of my clan, Amagqirha. How did Amagqirha do certain rituals in this family? How did Amagqirha do Thanksgiving in this family? How did this Amagqirha do apologies to the ancestors in this family? How did we do lobola negotiations? How did we
So it's like an internal language of the clan that has to be relearned. That has to be relearned.
Absolutely. So, it is so beautiful.
Dr. Menze, May you be blessed in the work that you do, that you take it deep and wide, not just in South Africa, but that it goes beyond. That this is a healing thing, not just for African lineages, because we all originated in Africa one long time ago. These are healing practices and ideas for us as human beings, as humanity. So I want to say siyabonga kakhulu, and may you be blessed. Thank you.
Thokozani, siyabonga, ndawuwe shewe ndaramao, siyabonga, thokozani.